Posterior dislocation causes damage to sciatic nerve. In hip joint, posterior dislocation is commonest. Regarding popliteal fossa, semimembranosus forms its upper medial margin. Fasciolatus forms the roof. Tendons of hamstrings lies against the femoral condyles during extended position of knee. They attack to the tibia and fibula head and lies against the femoral condyles. Arterial supply of the lower limb. Main arterial supply for the thigh muscle is provided by profound femoris artery. Anterior tibial artery lies on the anterior surface of interosseous membrane. Dorsalis patelis artery lies deep to the inferior extensor retinaculum. Popliteal artery lies on the anterior wall of the popliteal fossa. Dorsalis pedis pulse can be palpated between extensor hallucis longus and extensor digitorum longus tendon. Regarding femoral triangle, flow is formed by the psoas major muscle. Flow is medial to lateral adductor longus pectineus psoas tendon iliacus muscle. Even though the book says tendon, you can consider muscle as correct too. The deep extensor pudendal artery runs medially behind the saphenous vein near its termination. Obturator artery supplies the femoral head. Artery of ligamentum teres arises from the posterior division of the obturator artery. It is important in children as the head is separated from the neck by epiphyseal plate. All the muscles of the anterior compartment are supplied by the femoral nerve. Innervation of the muscle of the thigh follows one compartment, one nerve principle. Anterior compartment, quadriceps pectineus, sartorius, 3 iliopsoas, femoral nerve. Medial compartment, gracilis, adductor longus, pallidus, magnus, obturator nerve. Posterior compartment, hamstring part of adductor magnus, sciatic nerve. Vastus medialis is very important for the stability of the patella. Three important stabilizing factors. Vastus medialis indispensable in maintaining stability. Medial patellar retinaculum, forward prominence of lateral femoral condyle. Regarding popliteal fossa, both semimembranous and semimembranosus form the upper medial border of the popliteal fossa, and popliteal artery is the content of it. From deep to superficial content the content of the popliteal fossa are popliteal artery, vein, and tibial nerve. Tibial nerve runs vertically down the narrow interval between two heads of gastrocnemius. Common peroneal nerve runs downwards and laterally medial to the biceps tendon. The roof of the popliteal fossa is formed by fascia lata, superficial fascia and skin. Flow is formed by popliteus muscle and popliteal surface of the femur. The popliteal artery can be palpated in normal individuals. The pulse of the popliteal artery is the most difficult of the peripheral pulse to feel because the artery lies deep in the popliteal fossa. May be impossible in obese and very muscular individual. Weakening or loss of the popliteal pulse is a sign of femoral artery obstruction. Regarding the foot, pulsation of dorsalis pedis felt between extensor hallucis longus and extensor digitorum longus tendon. The dorsalis pedis arterial pulse is found by palpitation against the underlying tarsals, immediately lateral to the tendon of extensor hallucis longus from the midpoint between the malleoli to the proximal end of the first intermetatarsal space. Heel is supplied by the first sacral spinal segment. Tibial nerve innervates the heel by S1 root. Tibialis anterior assist intervention of the foot. Intervention tibialis anterior and tibialis posterior. Extensor digitorum brevis is supplied by deep peroneal nerve. Extensor digitorum brevis is supplied by the lateral terminal branch of the deep peroneal nerve L5 and S1. Medial plantar nerve supplies the plantar surface of the big toe. The medial plantar nerve supplies the sensation to the plantar aspect of the great toe, and the second, the third, the metatarsal half of the fourth toes. Regarding femoral triangle, flow is formed medially by iliacus and psoas major. Medial to lateral, adductor longus, pectineus, psoas, iliacus muscle. Femoral triangle contains nerve to pectineus. Iliac fascia continues to form the posterior wall of the femoral sheath. Femoral sheath is formed by anteriorly transversalis fascia, posteriorly iliacus fascia. Femoral triangle has an elongation of transversalis fascia. 56-year-old female admitted to Columbus South Teaching Hospital for investigation and treatment for varicose veins. Which of the following is are correct in regarding the venous drainage of the lower limb in this patient? When performing tendon back test, much of the foot is being tendon contract, causing blood to pump into superficial vein if the perforated vein are incompetent. Filling of the empties great sapness vein while performing the tendon and back test indicates incompleted perforators. Muscle of the foot assist the great saphenous vein is the dilatation of the femoral vein. Aneurysm of popliteal vein causes varices in the small saphenous vein. Small saphenous vein drain to popliteal vein, therefore an obstruction will to varices. Which of the following is regarding to knee joint? It communicates the medial gastrocnemius muscle. Medial bursa communicate with the joint cavity. Knee joint is a modified hinge joint. Tendon of popliteal muscle is inserted in the capsule of knee joint. The knee joint capsule contains the patellofemoral joint. Capsule attached the side of the patella anteriorly. Therefore, patellofemoral joint is within the capsule. Regarding the blood supply of lower limb, dorsalis pedis artery lies between first and second metatarsals. Femoral pulse is measured at the midpoint of the inguinal ligament. Femoral vein is posterior lateral artery at the apex of the femoral triangle. The front of femoral artery usually arises from the lateral side of the artery, femoral artery. Superficial external pudendal artery passes through saphenous opening and pass medially. Fibularis longus muscle has a sesamoid bone attached to it while lying against the posterior edge of groove of cuboid tendon. The possesses a sesamoid fibrocartilage. Deltoid ligament is attached to spring ligament. The extensor digitorum longus contract during initial phase of heel striking. Trauma of common peroneal nerve at the neck of the tibula cause foot drop. Deep peroneal nerve while supply the extensor compartment is a branch of common peroneal nerve. Regarding popliteal fossa, supromedial border semimembranosus, semitendinosus, superolateral border bisects humerus. Popliteal artery is the deepest structure in the popliteal fossa, therefore it lies anterior to the vein. Sural nerve passes between two heads of gastrocnemius. Popliteal surface of tibia forms the floor of the fossa. Recurrent genicular nerve is given off within the substance of peroneus longus. When femoral hernia is more common in female than men. Femoral canal is larger in female than male. Females have wide pelvis, thus femoral canal is larger in female. Hence, hernial sac can easily protrude. Abdominal fat content higher in females than males. Multiple pregnancies.